Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic, and today's video is all about testosterone as part of hormone replacement therapy in those who are born with female organs. So let's get started. So the first thing is to make sure that you are using testosterone for the right reason. So at the time of the filming of this video, the reason that we advise testosterone is if you are on established hormone replacement therapy and despite this, you have low sexual desire that is affecting your quality of life. We know there's lots of good research ongoing for other benefits like muscle mass, brain cognition and energy, but at the moment we don't have enough evidence to provide it just for that alone. So we've worked out that the reason you're having low libido is because of low sexual desire, and we've ruled out other causes of low libido. For example, severe vaginal pain during sex, severe lethargy that needs investigating as well. Once we know that this is likely to work, you need a blood test initially before starting it. This is to check that your levels are in female range. We no longer, currently when this video was filmed, need to do blood tests to make sure that it is why you're getting low libido is because of low testosterone, because we have found that the two do not correlate. Some people have normal testosterone levels and very low libido. Some people have very low testosterone levels and completely normal libido. So now we do it just to make sure it is in female range, ready to start in treatment. Once you have had that done, we can start treatment. In the UK currently, we have a number of ways that you can take testosterone. One is in the form of a sachet, and you'll have to forgive me, I don't actually have what we call a Testogel sachet because currently the placebo bottles that we use for demonstration are in a bottle, they're not in sachet form, whereas Testogel actually comes in a sachet form. So I'm using a different sachet here. The other form is a pump action called Tostran. So Testogel we use every day. Tostran is every other day. And then we have something that is currently available privately called Androfen, and hopefully NICE are trying to prove this to get this on the NHS, and that is a syringe action. Testogel is one that is the most tricky because if for female range, it is currently 1/8 of a sachet. So I've got a tip for you. If you are using Testogel, 1/8 of a sachet is very faffy. How are you going to guesstimate? So my tip is buy a syringe, or you may even have a syringe line at home. This is actually a Calpol bottle, a paracetamol for children. I have hundreds of these syringes lying around, so it's free. So my tip is take the tip of the syringe out, take the plunger out, pour the whole sachet into the syringe, and then you can mark it with a marker, 8 little markers up to where that amount of sachet has been poured in. And then every day you just do 1/8 of that syringe. So one of the first actuation you would do, and you would put it on your lower body, rotating the site every day, and preferably a fatty area. So for example, on the first day you would do it on your lower left tummy and just grab a little bit of fat and put it on there. The next day the right side, the next day your right buttock, the next day your left buttock, and just keep rotating the site every day. The reason we do that is to try and avoid local hair growth. So the main side effect is local hair growth. You may also get some mood and skin changes initially, but this should all settle down. Where you get those dramatic side effects we worry about, for example, getting a hoarse voice, for male hair growth, your clitoris enlarging, is when we do not monitor safely. So that is why we monitor it. So that is how you apply testosterone. Okay. Now, the next thing is, what do we do in terms of monitoring it? So at 3 months, we would advise a blood test, again, to check that it is in female range. If we do this, then we are safe, and it is unlikely you are going to get any of those side effects. With that blood test, we then want to review. We want to check how you're getting on with it, how you're getting on with applying it, are the blood tests normal, and actually, is it working? Firstly, the blood test being abnormal. There's a few things that you can do for this. My tip is to make sure you do your blood test before you apply your testosterone that day. The reason being, we want a trough level. We want a low level rather than a peak level. So if you apply your testosterone, then do the blood test, the likelihood you get very high levels. My other tip is make sure you're not on biotin, because biotin can affect your levels. So making sure, if your blood test comes back abnormal, making sure you haven't done any of those things. If your blood test is normal, at your review, we want to make sure how you're getting on with your treatment. Is it working? If your treatment by 3 to 6 months is not working, it is unlikely to work. So at 3 months, if you're getting on well, If the blood tests are normal, then what you would do is have another blood test 6 to 12 months and review it then. Okay? If your blood test is abnormal, we want to do all these little tricks I've just said to you and then repeat the blood test in 3 months' time. What if the third thing is, if you're getting on with the treatment but you're not convinced that you're noticing any improvement, then we have another review at 6 months. So you've had a 3-month review, you're not sure, have a review at 6 months. If at this point you are not noticing difference, it is unlikely to work and I would advise you stop the treatment. Okay? And then again, review with your specialist what could be going on and what the real reason could be behind your low libido. So just to recap, you're going to have a blood test before you start treatment to make sure it's in female range. You're going to start your treatment and have a review at 3 months, but before your review, you're going to have a blood test to make sure it is normal. If at that review you're getting on great, the blood test is normal, then you can just have a blood test every 6 to 12 months. If the blood test is abnormal, you need to make sure that you're doing your blood test before you apply your treatment that day and make sure you're not on biotin. If you're not noticing great improvement, then instead of just having the review at 3 months, you're also going to have a review at 6 months. If at this point it's not working, then I would stop the treatment. If you're getting on well, then as I said as before, you can just continue your treatment alongside your HRT, have your regular reviews that you will, and just do a blood test every 6 to 12 months to make sure it's in female range. I hope that video was helpful. Take care.